guys. In this lesson, we will explore what an X-ray is, why the patient might have one, and what your role as the nurse is. So an X-ray is a diagnostic test that allows us to view matter on the inside of the body by using electromagnetic wave radiation. So let's explore how this works. So tissue absorbs electromagnetic waves differently. So they show differently on the X-ray picture. So more dense tissue, like bones, for example, are going to show as white, like here. And then air is going to show as black, like in the lungs here. Fat and muscle show as more of that kind of grayish colored right here. So why would we need to do an X-ray? So of course, if there's a suspected broken bone, like in the arm, an X-ray would possibly show that break. Any suspicion of lung disease, like pneumonia, can be visualized in an X-ray where it's this grayish, foggy colored like this instead of the black. If a patient has digestive issues like severe constipation or abdominal pain, the doctor might order an X-ray to look for any disease processes in there. Another common reason for an X-ray is if a tube or device was placed in the body, like an NG tube, where you have to just make sure the tip of the NG tube is in the stomach. Now let's discuss you as the nurse and what you're going to do to prepare that patient for the X-ray. So when the doctor orders an X-ray, you're going to inform the patient that it was ordered, what it is, and why they're getting one. Make sure the patient isn't pregnant because that radiation can harm an unborn child. Answer any question that the patient has. And if you don't have all the answers, that's okay. Just call down and ask the radiology technician. Informal consent is going to be needed, which just means ask the patient if they're agreeable to have the X-ray. You don't need a signature because this is a non-invasive test. Lastly, just make sure that the patient empties their bladder because the radiologist needs a clear picture without a full bladder in the way. Now let's move on to the procedure. So you're going to assist with positioning the patient according to the body part being viewed. So a protective lead shield will be placed over sensitive areas of the body that aren't going to be viewed. That way we avoid any unnecessary radiation. Encourage the patient to stay still during the test. This is going to help it so that's a very clear picture, and that way we don't need to redo this picture. You're not going to remain in the room, but instead step out so that you're not exposed to that radiation. When the X-ray is over, go ahead and remove that protective shielding. There aren't any special cares required after an X-ray. It was non-invasive. So let's explore patient education next. So explain the importance of staying still during that X-ray. That way another one's not needed. Let the patient know that the radiologist is going to interpret the results from that picture, and then the doctor will be able to provide those results to the patient. All right, so the priority nursing concepts for the patient with an X-ray are communication, patient-centered care, and safety. All right, so let's review the key points. So an X-ray is a diagnostic test that's used to look inside the body, and it uses electromagnetic radiation waves to diagnose disease or verify line or device placement. Before the X-ray, I want you to explain the procedure to the patient, get that informal consent, and make sure they empty their bladder. During the procedure, you're going to want to help position the patient and put that protective shielding on any area not being viewed that doesn't need to be exposed to the radiation. After the procedure, go ahead and remove that shielding, and there aren't any special cares afterwards. Patient education, I want you to let the patient know, hey, the radiologist is going to interpret this, so it could take a little bit, and then the doctor is going to give you the results after. All right, that's it on X-ray nursing considerations. Now go out and be your best self today, and as always, happy nursing.